Hello everyone. Today I would like to talk about hair loss. Now there are many different types of hair loss, but we could probably divide them up into two major kinds. Those that have inflammatory processes and with resultant scarring and hair loss, and those that um, do not have scarring, whether or not there's inflammation present. Now, today I would like to talk about specifically hair loss that does not have scarring, because the management of hair loss with scarring is a little bit different, and maybe someday we can talk about that. But essentially, whenever there's hair loss and there's no evidence of scarring, there are many different things that can cause it, or many different factors that can result in hair loss without scarring. But one of the major reasons is if there happens to be an underlying inflammatory process that has not been treated. Like, for example, if a patient happens to have itching, tenderness, discomfort, burning sensation, flaking of the scalp. Well, there's likely to be an inflammatory process that is not being treated, and if appropriately treated, the hair loss may be reversed or significantly diminished. Or the other possibility is if there's an underlying medical condition, whether that medical condition is a chronic medical condition like heart disease or diabetes or high blood pressure that is not under good control, or if the patient happens to have a vitamin deficiency or another kind of nutritional deficiency like iron or zinc or thyroid problems. All of those can contribute to hair shedding. If the body experiences an emotional stressor like the loss of a loved one or the birth of a baby, or if the individual happens to be in a bad car accident or had a prolonged hospitalization, well, all of those are emotional stressors that can be stressful enough for the individual to result in hair shedding. And then last but not least is the fact that if given sufficient time, all of us will thin over time. Or maybe I shouldn't say all of us. There certainly are those exceptions, but I think we're pretty safe to say most of us will thin over time. So what can be done for somebody who comes in with hair loss and it's not the type that results in scarring? It's important to note that it's good that it's not scarring, because whenever there's scarring, that means that the hair follicles have significantly, have essentially been obliterated. They're no longer present. So the likelihood of there being hair regrowth is significantly reduced. However, when there isn't scarring present, well, at least theoretically, there can be hair regrowth. So what can be done, if anything? Well, the first thing to do is to have a good evaluation to see if the scalp is healthy. Is there any inflammation present, to treat the itching, the flaking, the redness, the tenderness, the burning sensation? Is there any inflammation present that needs to be treated that could be contributing to the hair loss? Are there any nutritional deficiencies or vitamin deficiencies that could potentially be corrected? Or has the thyroid been checked? Is there anemia present? Are the medical conditions being appropriately addressed by the primary care doctor? All of those are factors to consider in somebody who has a non-scarring hair loss. And last but not least is the fact that over time, all of us, or I shouldn't say all of us, most of us will thin. So if we happen to go down the list and we end up in that group of individuals that happens to have um, um, you know, does not have an underlying medical condition, does not have a nutritional deficiency, does not have a significant stressor. If we happen to be one of those individuals, well, what do? This is nature taking its course. Is there anything that can be done? And the answer is yes, there is. There's actually quite a bit that can be done. There's multiple things. There's some over-the-counter vitamins that can be recommended for individuals to take that reduce the likelihood of hair loss. There are topical agents that are sold over the counter that help so that the individual does not continue to have hair loss. There's also some systemic agents that can be, or systemic medications that can be prescribed so that the individual, depending on whether they're male or female, experiences reduced hair loss. Sometimes they can even experience some hair regrowth. But here's the shocker. There are now even some procedures that can promote hair regrowth in the right patient. Now, it doesn't work for everyone, but it does work for a lot of people. And for some people, having a chance at having hair regrowth is worth undertaking certain procedures. So how do you know what category do you fall into? Whether or not you have an underlying inflammatory condition that could be reversed, whether or not you have an underlying nutritional deficiency. Would you be a candidate for some of these systemic medications? What is ideal for you? The best way to know is to be evaluated by a board-certified dermatologist. So, if you find yourself in front of the mirror, staring at your hairline, taking out your phone, trying to take pictures of your scalp to see if there's any significant hair loss, are there bald spots, is this progressing? Don't despair. You're not alone. I hear this all the time. Pick up the phone, make an appointment with a team that is supervised by a board-certified dermatologist so that you can be appropriately evaluated. From the Alamo City, this is Dr. Ana Sauceda, helping you put your best face forward. Take care.